It is a balanced report. It acknowledges the improvements that government has put in place, but also acknowledges the gaps that still persist that the government should be able to fill.
The study conducted in districts, including Kalangala District, Buvuma District, and Namisindwa District, reveals that access to adequate health care remains a major challenge. This is attributed to limited communication infrastructure, with many islands lacking reliable network coverage, especially during emergencies.
We found that, for example, Buvuma, they mentioned that they had water ambulance, but it was difficult to fuel these ambulances. Had a sub-county in Kabong district called Timu sub-county, but in this sub-county, they didn't even have a health center 3. The only health center there was a health center 2. It was operated by one nurse to make matters worse.
Residents also depend on a single mode of water transport, which is often unreliable and expensive.
For a single trip, one has to spend around 300,000 shillings. Now imagine you have to go to the mainland, and then when you heal, you will have to come back home. So that is a trip of about 600,000. But then when you reach the mainland, you need a land transport, which is an ambulance to transport you at the mainland from one place to another.
The absence of healthcare center 3s in sub-counties, coupled with the shortage of health professionals, denies communities access to critical services such as maternal care, laboratory testing, and emergency treatment.
I want to talk about the health policy. It states that each district should have at least a health center 4 or a district hospital. But in some districts we visited, like Namisindwa, you find that there is no health center 4, government health center 4, but also there is no hospital.
The chairperson of the commission, Safia Nalule-Juku, has called for urgent government intervention to address these challenges and ensure equitable access to health services.
It is therefore important that we collectively come together to reflect on these issues and identify practical approaches that will ensure that all Ugandans, regardless of their geographic location, can benefit from quality health services.
Various stakeholders at the report launch share their thoughts on the report.
Even you'll find that the planning for medicines and supplies is poor. They will plan maybe for half the population.
We were given boat ambulances, and we are very grateful. But the cost of operating a boat ambulance, we have given some maintenance money, 5 million for a quarter. But you can't make more than 10 referrals.
Without prompt intervention, the report warns that thousands of residents in island communities will remain cut off from life-saving health services. Rebecca Natongo, Susan Inabugude for UBC News.